There we go. I'll just give it 30 seconds just so we get at least one person here. So. Lovely. So we'll get cracking then. So thank you for everyone for joining today. My name is oh sorry, the lobby keeps popping up as well, so I have to admit everyone as we go. So my name is Gemma Ridley. I'm the South Yorkshire Innovation Hub Director, based at Health Innovation Yorkshire and Humber, although our partnership is with South Yorkshire ICB also. So this webinar is part of our Bitesize series, and today's session will focus on economy and be covered by a presentation by Tina Slater and Jenny Holmes of the South Yorkshire Mayoral Combined Authority. And it'll be followed by a question and answer session as well. So as I said, the webinars in this series highlight research and innovation best practice across the South Yorkshire region and have been running weekly from September, and January as our last month, with each month has focused on a different theme. So we've had cancer, children and young people's, prevention, workforce, and this month is all around the economy. These have been in line with the 10-year health plan, and we wanted to maintain energy around innovation as a national priority because we all know innovation drives progress, it enhances problem solving, fosters growth, which will forever support our health and care industry. So we hope today you'll feel inspired by our speakers, gain insight into research and innovation delivery, and take away any tips to use in your local workplace or system. So to begin with, I'm just going to run through a couple of house rules and reminders. We'll be recording the sessions today, and they'll be uploaded onto the South Yorkshire Innovation Hub website, which I'll post in the chat once we get going. You'll have noticed your cameras and mics will be kept off for the duration, apart from myself and Tina's for the speaker. But please do post any questions and answers in the Q&A section or in the chat, and we'll pick these up after the presentation. We want to keep these webinars really interactive, so we're going to be using polls throughout the session. So please do get involved with those. So to test those and to test my IT skills, I'm just going to launch the first one. It should pop on up on your screen now. So this is around why you joined today. So if you just select your answer, and then it'll come back, it'll show you how everybody's answered on there. If it doesn't pop up on your screen, it'll be in the chat function as well. That's great, lovely. Okay, so that'll be running in the chat as we go, so please do feel free to nip into that and have a look. Now I'm going to pass you over to Tina and Jenny, and they'll tell you a bit more about the Pathways to Work initiative. Thanks.
Good morning, everybody. I'm Jenny Holmes. I'm Interim Director of Work and Health at the Mayoral Combined Authority.
Hi, good morning, everyone. I'm Tina Slater. I'm Head of Employment and Careers at South Yorkshire Mayoral Combined Authority. Lovely to meet you all.
Up the slides.
I will.
And we will take it in turns to talk you through our Pathways to Work programme. We've got a bit wider than just Health and Growth Accelerator, recognising a lot of the expertise is in the ICB and rather than the Mayoral Combined Authority. But what we like to talk about is the systems innovation that we are curating and collaborating on with health colleagues as a sort of social innovation, really trying to coordinate all of our employment support programs in a different way, in a more coordinated way for greater benefit in South Yorkshire. And just to remind colleagues of the level of ambition set by national government, we have a target of an 80% employment rate, and we are some way off that in South Yorkshire for a variety of reasons. And we know the productivity benefits we get from an 80% employment rate, but also the significant health benefits when people are engaged in good. So just some innovation topic areas that Tina and I are going to whisk through quickly this morning. Firstly, a quick overview of pathways to work, and why there is innovation in the employment support system that we are designing alongside health colleagues and a wider range of colleagues in South Yorkshire. We'll then talk a bit more detail about Health and Growth Accelerator activities and also our Trailblazer programme in South Yorkshire. And particular areas of focus is using population health management approach in the Health and Growth Accelerator programme, the personalisation of support that runs across all of our programme interventions in South Yorkshire, hyper-local commissioning and the flexibility to iterate, which is a particular characteristic of our programmes, and again, a kind of innovation in terms of how we want to be able to reach our communities, and employer engagement, where we're trying to organise a system-wide approach to how we engage employers so there's less kind of confusion in the system. So just to give you a little bit of an overview of pathways to work, what we're trying to achieve across all of the employment support in South Yorkshire is a single joined up system, bringing together employment, health and skills to support people wherever they're at in their lives to get into and maintain good work. People we know from all of the research face a wide range of complex and different barriers, from health conditions, care responsibilities, skills gaps. We hear about transport needs, confidence issues, particularly in our young people, we see from the data that's coming through and the research that we're doing with young. And we're trying to be flexible and responsive and bespoke to those needs, recognising that everybody's different, they're in a different stage on their life and in their journey. So we are also working with people to help them in work and stay in work and to progress in work. So the interface with the skills system is important as well. So people can not only get into work, but progress and stay in work, increase their salary and improve well-being. We set this out in a plan that was agreed by the Mayoral Combined Authority Board and with support from the Integrated Care Board back in September. And that looks at 4 pathways. So early intervention, intensive support, enabling job-ready individuals to access support, and then supporting people to thrive in their workplace. Why it matters? Well, we know the fragmented support system doesn't work, so the feedback from the system is individuals find this a complex system to navigate. They sometimes can't access the level of support that they need or the type of support that they need. And employers struggle to navigate that system as well, and they often complain that they're approached by lots of bits of government asking them to do different things. So we're looking to develop a single joined up system that's led by the data and intelligence, system that triages for people that enter so that there isn't any wrong door, right support at the right time. So wherever you come into the system, you are referred to a program that suits where you're at and the support that you need. And potentially over the next few months, moving much more to a co-commissioning approach where we get all of the partners around the table to look at how we commission services based on a shared understanding of that data and that evidence base. Now, you might think this is kind of entirely sensible and what you'd expect to be happening, but the complexity in the system is such that it's actually quite difficult to do that. Funding comes from lots of different funding sources. Different bits of the same department give us different incentives in the system. Some's delivered by the market, some's delivered by the community sector. It's actually quite a complex system to sort of navigate and try and join up. So the partnership we have with health colleagues in particular, but colleagues in our local authorities, Job Centre Plus, DWP, skills system partners, voluntary community sector, these are all kind of partners that we want to increasingly kind of bind into this kind of singular approach to collaboration and work together. So it simplifies it for individuals and employers, and hopefully it improves the outcomes. It also should improve value for money as well, as we look at where there might be duplication, over provision in some areas, under provision in other areas. Obviously, the greater benefit of all of this is increased activity in South Yorkshire and inclusion and opportunities for people here. Not to go into this in too much detail, but to just highlight some of the complexity underneath those sort of areas that we are working with people. You'll see in this slide the wide range of programs that we are that we are involved in, that partners in South Yorkshire are involved in. So these are the projects and programs that we're trying to bring together into a single view of how we help people, really starting with what individuals need, their particular place, their particular health conditions that they might face, their particular barriers, rather than being led and driven solely by the outputs that we're given, particularly by government, to deliver against all of these. But you get a sense of the volume of the programs that sit beneath these themes that we're trying to manage and work. Just to speak in a bit more detail now about Pathways to Work. Pathways to Work was led by Barnsley in particular, Barnsley Council, Sir Steve Houghton and his team there, really kind of putting forward to national government a different way of coordinating and triaging support for an individual. So really, Pathways to Work then became the national programme. It's very much led from South Yorkshire. Particularly leading to the allocation of Trailblazer funding, but also to Health and Growth Accelerator funding for South Yorkshire as well. Health and Growth Accelerator funding aligned around those three ambitions, and we'll talk a bit about the sorts of interventions that sit beneath that, and Trailblazer around those sort of four themes, which are more about sort of systems integration. You'll see on the right hand side again that list of other programs that we are trying to kind of align with this way of working, or everything into one system. And then just to highlight also, we a lot of the focus of this work is on people who are unemployed or economically inactive, but we need to just remember that a lot of people we need to support really in the prevention or early intervention space, and then immediately after they're potentially unemployed, is people who are currently in work. So you'll see from this, actually a big proportion of people could be recipients of support, could be targeted for more support, are actually in work already. So how do we make sure that as we are designing programs going forward, that we adequately account for where the actual need is and get upstream of the challenges that we see in the labour market by helping people early doors. So that's a kind of bit of a sense of what the targeting looks like in South Yorkshire, and particularly the need to kind of keep that focus on people as well as on. I'm going to hand over to Tina now, who will talk in a little bit more detail as well.
Thank you, Jenny. So this slide sets out for us the population health model, which is aligned to the system of Pathways to Work. So we have reviewed the data that really identifies who is most at risk of falling out of work, and where really earlier intervention could make the biggest difference, and then really segmented the population into groups that can align to our key programmes that you can see here on the slide. And that includes people already out of work due to long-term health conditions, and people who are still in work but struggling as well, and showing other risk factors such as repeated absences, for example. And this approach really allows us to target support more effectively and move towards prevention rather than waiting until people have exited the labour market. An example of the population health approach in action is through the Health and Growth Accelerator. So the Health and Growth Accelerator launched in April 25 and has a focus on supporting 950 people, and that is up to the end of March this year. And that is to maintain their employment through work and health support. The Health and Growth Accelerator has three key priority areas. Priority area number one is supporting people that are in work with repeated or longer term absences and at risk of falling out of work. There is priority two, which is focused on supporting young people who are struggling to remain in work or education, or even entering the workplace due to existing health conditions. And then priority three is focused on enhanced occupational health and wellbeing support, and that's through working with our local employers. So what this does, it brings together the identification, the assessment, and access to intervention through a single hub. And that acts as a connector across health, employment, and community support. The emphasis of this is early tailored support and to help people again remain in work and avoid that long-term economic inactivity. So the population health data has been central really to how the Health and Growth Accelerator has been designed and delivered. Analysis showed that people with mental health and musculoskeletal conditions, particularly those with a history of repeated fit notes, are most likely to fall out of work. So the South Yorkshire ICB has been working closely with NHS England and developed primary care searches to identify those priority groups. GPs were asked to review and ratify lists that were developed to ensure the approach was clinically safe, and patients were then invited onto the programme into one of the priority areas. One of the key learning points so far in this has been that kind of the data is key, but what we've seen is that engagement has improved quite significantly when it's combined with that personal follow-up as well. So in terms of the data, what it has also highlighted is that we have a distinct set of challenges facing young people, hence the formation really for priority area number 2. So this cohort includes young people that are aged 16 to 24 who were in work or education, who are not in work or education but struggling, and those that are not currently in work or education, apologies, I've said that the wrong way round, and those finding it difficult to enter into the workplace. So in many cases, the barriers are linked, what we've seen, to anxiety, some depression or neurodiversity, rather than a lack of a skill set alone. And this insight has really led us to designing that specific offer within the Health and Growth Accelerator that focuses specifically on young people. And part of that focus in response to priority 2 is a peer connector service, which is delivered across all of South Yorkshire. However, particularly in Sheffield, it's delivered by an organisation called Sheffield Futures. So Peer Connectors works alongside young people using a strengths-based approach to co-create personalised support plans which focus on what matters to young people. Support is delivered both online, and in person, helping young people explore their aspirations and overcome any barriers, and help them to take some practical steps towards employment or education. What this also does is it's also integrated with local colleges in the area and youth hubs as well, that are delivered through local authorities, ensuring that young people can meet and access support in areas that they feel comfortable and safe in. So the Trailblazer takes a hyper-local commissioning approach. So this is working with trusted local organisations and community-based teams. This approach is particularly important for engaging people who are least likely to access what we'd call traditional employment support. Hyperlocal delivery helps us to build trust with the people that we're working with. It enables trauma-informed practice where needed, and also allows services to respond flexibly to local and personalised needs. It helps us to integrate employment, health and skills together, ensuring that support is embedded into the local ecosystem and strengthening the system overall. So our employer engagement is really critical to pathways to work in ensuring that the system and the services are effective. Employers have told us that the support that they either access or can see available feels really fragmented and difficult to navigate. Data shows us that workplace practices play a major role in whether people stay in work too. So our response to this includes a digital employer portal which will capture information, data, support available for employers to access. So they've got one point they have one point of contact. This is planned for launching in spring this year. We have a targeted wage subsidy for young people. This is now live and available for employers to access via each of the 4 local authorities in South Yorkshire. We also have campaigns that are promoting inclusive recruitment and workplace wellbeing as well. So in addition to that, we are working through with our ICB colleagues a public sector HR directors forum, and this is to ensure we're leading by example across the public sector, and the first forum for that took place in December last year. So just lastly as well, in addition, so South Yorkshire has recently been announced as a vanguard for Keep Britain Working. So we hosted a visit also in December last year with Sir Charlie Mayfield, his team, our partners and employers. So the conversation really kind of focused on that, you know, kind of returning to work, staying work, and what we can do in terms of prevention as partners working together. So work for the Vanguard will develop over the coming months. And if anybody that is attending today would like further information or would like to be involved in any of the work or activities that myself and Jenny have outlined, our details are available also on screen for you to take and contact us directly. Thank you.
That's wonderful. Thanks, Tina. That was really, really interesting, and thank you, Jenny, as well. So just before we go into the Q&A session, so get your thinking hats on, people who are on the call, and pop them in the chat. I'm just going to launch a couple of more polls just so we can get some impact information for this. So the next one should pop up now. Did you learn something new today? I certainly did. Wonderful. 100%. So that's good. One more second. So the second poll, did you find the presentation helpful today? Again, it's a yes from me. Wonderful. And then one final one before we move into our Q&A is, does this theme link in with your current work priorities? Wonderful. 100% all round. That's great. So it is a great result.
We skewed it slightly by voting as well.
Don't worry, so did I. Okay, so we've got one question from Annette. Who is the delivery partner in Doncaster, please, for the Youth Peer Connector service?
Annette, can I come back to you on... Oh, sorry, I thought I was on mute then. Can I come back to you on that? I just need to clarify that with ICB colleagues. I do have your details, so I'll make a note of it. Come back. Gemma, I'll also share with you as well, so you can share with the group if that's okay.
Yeah, that's fine. If there's anyone on the call who's, I saw a hand go up, we can't throw to hands, unfortunately, the way the webinar's set up. So if you do have any comments and things, if you just pop them in the chat.
Actually, Gemma, I've just thought Laura Evans is on the call from ICB, so she may, sorry to put you on the spot, Laura, but Laura may know who the provider is in Doncaster. So if it's possible, would you please pop it in the chat, Laura? If not, I'll pick up with other colleagues and circulate that.
Yeah, I should be able
Thank
to
you.
allow Laura to come in. Just 1 second, let me see. Laura, has that enabled your mic? I don't think it has. Never mind. Yeah, so if you can post that in the chat, Laura, that'd be fantastic. Technology, hey, who'd have it? So if there's any more questions, yeah, just keep them coming in the chat or in oh, let's see. They keep popping up. So again, another point from Caroline. Thanks, Caroline. So yeah, really engaging presentation. Thank you. I know you said you wanted to reach 950 people in the programme. Just curious, approximately how many people have been supported to date, please?
Again, unfortunately, on that one, I will have to come back. We don't have those details to hand with us, unfortunately, but we'll make sure that that is available to be shared.
No problem. What we'll do is we'll make sure when we upload this to the website, we can upload some answers to the Q&A, etc. So that's fine. Another question from Annette. Thanks, Annette. So there was also a mention of Working Win, and she was under the impression that they'd lost that contract. So where are we with the Working Win as they used to come into the job centre?
Yeah, so Working Win, there isn't any contracts that has been lost. Essentially, Working Win has the services have now come to an end. However, Connect to Work is the successor really to the previous Working Win. So it's the same program delivering IPS support and SEQF support. In Doncaster and it's South Yorkshire Housing that are delivering. So please kind of refer people through to the program. So there isn't any drop in service. Working Win will continue to support those participants that were on program up to, I think it was November last year. So they'll continue to support them for a further 12 months to ensure that those people are supported into work or to stay in work. But like I say, the service for IPS and SEQF is still very much there. South Yorkshire Housing delivering across Doncaster, Rotherham and Barnsley, and Shore Trust are delivering in Sheffield for the colleagues on the call. But please do refer people through to those partners. And if any further details are needed, please contact me and I'll be happy to make some further introductions.
Lovely, thanks, Tina. I suppose I've got a quick one. Obviously, the accelerators and pathways to work involve a lot of partners. What has the difference been in working with all those partners, and what do you think have been some of the successes and some of the challenges of that as well?
Yeah, so significant opportunity and significant benefit from getting everybody around the table in terms of a singular approach to governance. So making sure that the Work and Health Board that involves lots of different partners have oversight of these programs and are able to contribute to how they are operating. So I think certainly getting the governance to be a kind of collective effort has been really, really fruitful. I think in the opening stages of putting together both programs, there were some quite challenging conversations, but I think if you're going to work as good systems partners, you need to be able to have those sort of robust conversations as well as the kind of celebratory ones that we have as well. So some really some really good progress in terms of the governance arrangements. I think then operationally, again, bringing partners together has been very fruitful, and we're just about to go through another round of that, bringing together all of the employment programme SROs in South Yorkshire into a singular kind of programme oversight board. So real opportunities there. And I think as we move into this year, we'll be able to look at the opportunity to co-commission. So if we all have the same sort of data about the economy, the same sort of data about who we're trying to support, we all have our kind of programs that we're responsible for, but what's a sensible way of doing our commissioning? So instead of going off and doing it in a way that's just kind of aligned to what we've been asked to do by government, is there a different conversation where we look at, actually, you're probably best to commission this sort of support, we're best offering this sort of support into the system, so we can really look at how and where we play to our strengths in South Yorkshire. So definitely a work in progress. We have commissioned an evaluation as well, so we're looking at both a kind of formative and a summative evaluation. So how do we learn as we're doing this work, and then has it been successful? So I think loads to learn, but I think that commissioning and that shared sort of governance sort of approach has been two areas that I would highlight.
Mm-hmm. Yeah. Great, thanks so much, Danny. So, if there's no other questions, I'm just aware of time. I'm going to bring our session to an end. But before we do, I've got another couple of polls for you. Really stretching my IT tech skills today. So this one should be a word cloud. So this is all around what will you do with the information that you've shared today. Again, if you've got some thoughts, you can add them now, or you can go back into the chat once we've moved through and add those in. But yeah, if you can share what you will do after with what you've heard today, that'd be grand. And then just one final one. So we do have some more bite-sized sessions happening for the rest of the month. So would you attend another bite-sized session? Have these been really useful for you? And we are thinking about doing some more as we go into the next financial year as well. Wonderful. That's a clear indication we should do some more. Wonderful. Thank you. So I'm just going to close the session now. So thanks to Tina and Jenny for joining us today. As I said, all our bite-sized webinars have been recorded and they'll be uploaded to the South Yorkshire Innovation Hub website, which you can find the link in the chat if you scroll up. So this webinar is part of a whole South Yorkshire Bite-sized Hub series, and to book on future sessions, you can find those on our website as well. So again, thanks to the speakers, thanks to everyone for spending your time with us today, and we'll see you at another event. Thank you.
Thank you all. Bye.